one of the physicians who works at Oregon Reproductive Medicine. I'm the medical director. We've been working with same-sex couples and single men and women through egg donation and surrogacy now for over 10 years. And it's interesting how this process evolved, and some of you may have been in the last session, and if you were, I may be repeating myself, but we started helping men have babies through egg donation and surrogacy about 10 years ago, and it happened almost serendipitously. I mean, the initial patients we were helping were men from Portland, but then we started getting inquiries through the internet from men throughout the United States, and as well as from Europe, and from Asia, and from Israel, and from Australia. And so our reputation just grew. And the main reason why we initially had this appeal to men is that men were able to access the data regarding how successful different fertility clinics in the United States are. Because all of the fertility clinics submit data to the Center for Disease Control, the CDC, and to the Society for Assisted Reproductive Technology. So our statistics regarding success rates through IVF are all posted on the internet. And you can compare one clinic to the next, particularly if you look at the website www.sart.org. So we all submit our data regarding egg donation pregnancies. So if you look at that information, you can get a sense in terms of the quality of the laboratory, because one of the biggest factors that really influences pregnancy rates is the environment in which we grow embryos. So even though we all do the same thing, all the fertility clinics you'll talk to put the eggs and the sperm together, they let them grow. In some labs, they don't grow as well as in other labs. So fortunately, I think through a variety of reasons, our program has had very, very successful statistics. For many years, we've had very stable pregnancy rates. There hasn't been significant fluctuations from one year to the next. And everyone going through this process wants success. We want people to get pregnant the very first time. We don't want to have them have to do 2 or 3 cycles because it's more expensive. It's certainly more stressful, and in your particular type of need, the success rate should be extremely high. When we've analyzed our statistics for egg donation surrogacy cycles using fresh unbiopsied embryos, the ongoing pregnancy rate, if we put in 1 embryo, has been 85%. When we put in 2 embryos, it's been 89%. So very, very similar. When we put in 2 embryos, the ongoing pregnancy rate of twins is about 60%. So more than half of the people who have 2 embryos placed into the surrogate will end up with twins. That either can be good or bad.
On the first try.
On the first try. That's either good or bad depending upon your point of view. As speakers have said earlier in the day, twin pregnancies are much higher risk. There's a higher risk of early delivery with resulting complications for the babies. So in essence, we're hoping to achieve a healthy pregnancy, and most women who get pregnant with twins do fine. But there is a small percentage that they could deliver very early, and if they do, then there's a greater risk for long-term complications for the babies. Plus there's greater expense because there's more medical care that the children will need to receive after they're born. Now for Americans, usually American parents have health insurance that would cover the cost of the health care of the babies. For our international patients, they don't have that health insurance, so it becomes much more of an issue for them. Fortunately, in Oregon, we have very, very good insurance programs and good lawyers and agencies who really can help people, guide people through the process where there's unlikely to be any big financial burden in the case of an early delivery. One of the questions that came up earlier today is a question regarding genetic testing of embryos. That's something that we do offer. It's something that a lot of men ask for, but not everyone does. We have very high pregnancy rates without doing genetic screening. So the outcome data I was presenting to you a few minutes ago was with untested embryos, not biopsied embryos. The outcome with biopsied embryos is roughly the same. It's not it hasn't been better in our program. So there's questions as to how useful it may be. There are going to be a percentage of embryos that typically arise from an egg donor cycle that are going to be genetically abnormal. What we found in our program is that 22% of the embryos that we biopsy that have a normal appearance are genetically abnormal. So that may sound high or low to you depending upon your point of view. The embryos that are abnormal, the 22% of embryos that are abnormal, are not Down syndrome embryos. They're not embryos that necessarily would lead to the birth of a baby. So they have abnormalities in certain chromosomes that are always lethal. So there's only a very, very small percentage of embryos that are abnormal that we find could lead to a fetus. And of course, if we do identify those, we would never use them. So one of the things that people have to decide as they're going through this process is whether or not they want their embryos genetically tested. It's becoming more and more common. People are asking for it. We're glad to offer that service. We do have a genetic counselor who talks to patients for about an hour to make sure they understand the entire process so that they know what the benefits could be and what the potential risks could be. Some people do it because they want a child of specific genders. A lot of people would like to have a son and a daughter. And so sometimes people do that for that reason. It's not terribly expensive, but it does add to the cost. But our mission throughout the years has been one of good communication and of support. And I really mean that sincerely, because we really have a team of providers that really enjoy helping people have babies, helping men have babies. And so we're here for you, and even though we may not necessarily be living in your community, we can get the job done for you, and you will be part of the process at every step along the way. So there won't be any decisions that would be made without your full knowledge and your full engagement in the process. And Portland's a great place to spend a weekend. There's great restaurants there. A lot of people who come to visit us think about moving there. We actually have more and more New Yorkers moving to Portland, believe it or not. Yes?
I was just wondering, one of the things that always kind of turned me off to surrogacy was I was under the impression that it was very hard to get pregnant, and you're citing very, very high numbers of success. Is that because I'm used to listening to stories of, say, my 42-year-old female friends who are finding
Oh yeah, of course.
And you guys were using optimal eggs, optimal gestational surrogate with an optimal fertilization environment, hence you have optimal results.
Right, as an example, the normal chance for a heterosexual couple to get pregnant, if they're, say, 23, is about 25% per month, whereas in an IVF cycle, the live birth rate through donor egg IVF for infertile women is about 75% per try. So there's a lot, we're working with a lot of eggs, knowing that not every single egg we remove is going to fertilize, and a group of those eggs that do fertilize will never grow into an embryo that we can use. So there's a winnowing effect along the way to really maximize the chance of pregnancy occurring in 1 month of treatment. Yeah. Well, now I'm going to introduce John and Sandy from Northwest Surrogacy Center, and they're going to tell you about their surrogacy agency.
I think we only have just
3 minutes.
3 minutes, so, but that's fine.
But who's counting?
Who's counting? What I wanted to do was to talk real quickly about Northwest Surrogacy Center, which is a program located several miles away from the clinic. And it is in Portland. All of our work is in Portland, although most of our clients come from actually out of the country. More than half come from out of the country, and of the remaining probably half are outside of Oregon. Dr. Haslam mentioned real quickly one of the more important aspects of the work that we do, and that has to do with insurance, because getting into this and seeing some of the insurance bills that can come up can be really just difficult. We have been working since 1994. Since 1994, we have never had a single situation where we had insurance that failed to pay for either the pregnancy itself or the birth. The second point that I wanted to make in just a few minutes here has to do with the law surrounding this. It's a very easy place for us to establish parentage for gay and lesbian families, so that we've been doing adoptions for 30 years for same-sex couples, never had difficulty doing it. So I want to underline the word never. We have, for our clients doing surrogacy, we have never had the courts either deny or delay establishing that both parents are the legal parents of the child at the same time, in the same order, describing them as a family and not talking about them being roommates. And what I wanted to do is real quickly give this to Sandy to tell you a little bit about the surrogates, which we think is the best part of our program.
All of our surrogates live in Oregon, which is an advantage to you. It reduces the complexity of your case, reduces the cost. I think you're paying less in travel expenses. Oregon has a healthy lifestyle, so that most of the women have good diets, good exercise routines, lots of time outdoors. All of the surrogates go through a number of different screening processes. We run background checks on them. When they come into our agency, we're looking for criminal histories and general social situations. They have a psychological evaluation done, and many other things. I'm out of time, it looks like.
Thank you very much, guys.
Thank you for coming
Thank you.
to our sessions.
So you're going to be outside of the expo, right?
Yeah.